So Wellbeing Trust is a new independent foundation focused on advancing the mental, social, and spiritual health of the country. And its first investor is Providence St. Joseph Health, that at the time of its combining wanted to lift up what has arguably become one of the most important health issues in the country, addressing the mental health crisis, anxiety, depression, substance use, suicide, that not only is ravaging the nation in numbers that we haven't ever seen before, but frankly touches every one of our lives, either personally or through our family and closest friends. Given that mental health has become such a challenge in its own right, but also that it has such a rate-limiting impact on the ability to change behavior around physical activity and nutrition, tobacco, and other drivers of health that are impacting other chronic disease rates, Wellbeing Trust is lifting up this priority as a key focus for the nation to improve health and well-being and to, over time, reduce preventable utilization and make healthcare more affordable. Well, there's obviously all health systems and clinicians around the country are recognizing the need to be more innovative on these issues. We have to start by making sure that mental health and physical health are fully integrated in the care setting, whether it's in primary care or in the emergency department or acute care settings. And most of us have a long ways to go on that. And secondly, given the community nature of these issues, the social issues behind many of this, we need to also drive clinical and community integration. So moving beyond short-term projects and initiatives, the innovation really needs to transform not only care delivery and the care journey, but also the way in which we create healthier communities that are gardens to grow people in. In other words, how are we investing in what drives human flourishing in the first place? And so Wellbeing Trust, with other health systems, other philanthropies, civic leaders, faith organizations, and others, is being positioned to really help drive that innovation in a distributed way, like a social movement where there's not just a campaign or some anti-stigma campaign, as good as those may be, but really driving true innovation and transformation across the country. Our first grant portfolio is not only addressing national issues, a partnership with Institute for Healthcare Improvement on the emergency department at Upstream, a partnership with Trust for America's Health on a policy blueprint. But in California, where we've made our first place-based initiatives, we're investing in clinical and community transformation. There are not only significant gaps in access to the right care at the right time and the right place for mental health and substance use issues, and we need to make sure that that access is seamless so that people get the care they need when they need it with the right provider. But also in community. Some of our grants are focused on the homeless population, which obviously is often intertwined with mental health issues. We're also looking at crisis intervention centers so that rather than everybody ending up in an emergency department, some may need to go there. But how do we make sure that we're caring for people's not only clinical needs, but the social needs, housing, food access, home care, whatever else they may need to actually be able to keep them healthy and reduce their utilization of preventable care.